Hi, my name is Catherine. I'm the student nurse practitioner. I'm going to be performing your physical exam today. Can we proceed with the exam?
Yes.
What is your name?
Peter Sessery,
And how old are you?
35,
Okay, Pete appears as stated age. And what day is today?
July 3rd,
And-
2020.
And where are you?
I'm home.
Okay, Pete is alert and oriented ×3. His speech is clear. His posture is relaxed. His gait is steady as I observed him walk into the room. His facial expressions appropriate. His thought processes are relevant. His cognitive abilities are intact. Pete, I'm going to ask you to remember 3 words, and I'm going to ask you to recall them at the end of the exam. And those words are door, car, and phone. So remember those for the end of the exam. Okay, we're going to move on to the exam. I'm going to first start with the head. The head is normal cephalic. The scalp is symmetrical. I'm going to palpate the scalp. It's free of lesions. His hair is red, evenly distributed, no hair loss noted, and it is fine. Okay, the face is symmetrical. I'm going to assess the muscles of facial expression. Can you smile? Frown. Close your eyes tightly. Open your eyes. Raise your eyebrows. Show your upper and lower teeth. And puff out your cheeks. Alright, cranial nerve 7 is intact. I'm now going to assess your sensation on your face. I'm going to have you close your eyes and let me know if you feel sharp or dull.
Sharp. Dull. Sharp.
Okay, you can open your eyes. Cranial nerve 5 is intact. I'm going to assess the temporal arteries. They are elastic, 2+. I'm going to assess the temporal mandibular joint. Open your mouth. You can open your eyes. And move your jaw from side to side. Good. No clicking and the movement is smooth. Any tenderness?
No.
Okay, we're going to move on to the eyes. The external eye is, there's no drainage, no redness, no inflammation. The hair on the eyelashes and brows are evenly distributed. The lids are non-tender. I'm going to assess the your visual acuity. We're going to do the Snellen chart. I'm going to have you cover one eye and read the lowest line you're able to.
D-E-F-E-O-T-E-C.
Okay. And I would then repeat that on the other side. Cranial nerve 2 is intact. I'm going to assess your peripheral fields. I'm going to have you cover one eye, and I'm going to cover one eye. Let me know when you see my fingers.
Now. Now. Now.
Okay, good. I would repeat that on the other side. So Pete's peripheral fields are intact bilaterally. I'm going to assess your extraocular movement. Follow my finger with your eyes only without moving your head. Okay, cranial nerve 3 is intact. I'm assessing Pete's pupils next. His pupils are round, they're 3 millimeters in size. I'm going to assess Pete's pupillary light reflex. I'm going to turn the light off and shine my light into your eyes. Okay. I'm going to have you focus on an object over my shoulder and now look at my pen. Okay, so the pupils are equal, round, reactive to light, and a combination. We're now going to perform the ophthalmoscope exam. I'm going to darken the room again. I'm going to first identify the red reflex. Okay, it's round and bright. I'm going to advance in. The optic disc is visualized. Clear margins, it's creamy pink in color. The general background is a red-orange consistency. The macula is on the temporal side. And the optic vessels are visualized in all 4 quadrants, and no papilla edema was noted. We're now going to perform an exam on the ears. I'm going to first assess the external ear. There's no nodules, the skin is pink, there's no drainage. I'm going to palpate the ears. Any tenderness when I palpate? Good. I'm going to look at the external ear with the otoscope. I'm going to pull the pin up and back. The tympanic membranes are pearly gray, no drainage or inflammation noted. I'm going to perform a hearing test. I'm going to perform the whisper test. I'm going to whisper 2 words, and I want you to repeat each word, okay?
Yes. Apple. Orange.
Okay, good. I would then repeat that on the other side. I'm going to now perform the Weber test. I'm going to place my tuning fork on the top of your head. and I want you to let me know if you hear the sound on both sides or on one side more than the other.
Both sides.
Okay, good. Hearing is bilateral, no lateralization noted. Going to now assess the nose. The nose is symmetric, the skin is pink. I'm going to palpate the nose. Any tenderness?
No.
I'm going to palpate the sinuses. Any tenderness when I palpate the frontal or maxillary sinuses?
No.
Good. I'm going to inspect the nares. Good. No turbinates are free of any lesions. I'm going to do the nasal patency test. I'm going to have you close one nair at a time and sniff. And the other side? Good. I'm going to now assess cranial nerve 1. I'm going to have you identify an odor. Close your eyes for me. And let me know what you smell.
Alcohol.
Good. That's an alcohol swab. You can open your eyes. Cranial nerve 1 is intact. I'm going to now assess the mouth and throat. The lips are pink, free of any lesions. Open your mouth for me. The oral mucosa is pink, moist. The hard and soft palates are pink and moist, free of any lesions. The oral pharynx is pink, moist, free of any lesions. The tonsils are grade 1+. There are no lesions noted or exudate. I'm going to look at your teeth and gums. Go like this. Good. The teeth are straight and good repair. They're all present. The gums are pink, moist. No lesions are noted. Okay, we're going to move on. I'm going to assess your tongue strength. I'm going to have you stick out your tongue. And I'm going to grab your tongue and push against my resistance. Good. Okay. Cranial nerve 12 is intact. I'm also going to assess cranial nerves 9 and 10. I'm going to have you open your mouth again and say ah. Okay, cranial nerves 9 and 10 are intact. Okay, we're going to move on to the neck. The neck is symmetrical, no pulsations or lumps noted. I'm going to assess the lymph nodes. We're going to start with the preauricular, post-occipital, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and the supraclavicular cervical. Any pain when I palpate? No. Okay, I'm going to assess the trachea. Can you swallow for me? The trachea is midline and symmetric. We're going to assess the thyroid gland. I'm going to come behind you. Can you look to your right and to your left? Good. The thyroid is non-palpable. I'm going to assess the carotid arteries one at a time. Okay, it's 2+. Elastic no thrill noted. I'm going to auscultate for any bruit. Okay, no bruit is noted. I'm going to assess the range of motion of the spine. I'm going to have you look up to the cervical spine. I'm going to have you look up to the ceiling, down to the floor, to each side, and then touch your left shoulder to your left ear, right shoulder to your right ear. Any tenderness?
No.
Okay, full range of motion of the spine. We're going to now assess the upper extremities. So I'm going to look at the skin. The skin is pink. No obvious deformities or lesions. I'm going to palpate the joints. Any pain when I palpate?
No.
Okay, I'm going to assess capillary refill. Is under 2 seconds. Going to assess the epitrochlear lymph nodes. They're non-palpable. I'm going to assess the sensation in your upper extremities. Okay, let me know if you feel sharp or dull and close your eyes.
Sharp. Dull. 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 Sharp.
Good, okay. I'm going to now assess your reflexes. I'm going to assess the triceps reflex. Relax your arm. Okay, I'm going to assess the brachial reflex. Good. I'm going to assess the brachioradialis reflex. Good. Okay. I'm going to assess your range of motion and your strength. So bring your arms up and push against my resistance. Good. Put your hands behind your head, hands behind your back. Okay, bring your hands forward, open and close your fingers, and then bend your wrists up and down. Okay, good, perfect. We're going to now assess the posterior chest. I'm going to have you turn towards me. Okay, the posterior chest, the skin is pink. Respirations are relaxed, no use of any accessory muscles. I'm going to assess for tactile firmness. Just say 99 for me.
99, 99, 99.
Good. I'm going to percuss the posterior chest. Good. Lungs are resonant bilaterally. I'm going to assess for CVA tenderness. Let me know if you feel any pain. Any pain?
No.
Okay, good. I'm going to now auscultate the posterior chest. I'm going to have you take a deep breath in and out of your mouth. Good. I'm going to inspect the anterior chest. The skin is pink. No use of any accessory muscles. Respirations are relaxed. I'm going to palpate for chest expansion. Take a deep breath. Good. And I'm going to palpate on the posterior chest for chest expansion. Deep breath. Good. I'm going to palpate the anterior chest for tactile firmness. Say 99.
99, 99, 99.
Good. I'm going to percuss the anterior chest. Good. So lungs are resonant bilaterally on the anterior chest. I'm going to auscultate the anterior chest. Deep breaths for me. Good. All right. The lungs are clear bilaterally, no adventitious sounds. I'm going to now assess the cardiac system. I'm going to have you lie flat. Take the pillow out. Turn to the opposite side. Oh, I'm going to have you stay flat. Just your head. Turn your head to the opposite side. Good. Okay, no jugular vein distension. I'm going to now assess the precordium, and you can look straight ahead if you want. I'm going to look. There's no heaves or lifts noted. I'm going to palpate the apical impulse, which is at the 5th intercostal space of the midclavicular line. I'm going to assess the left sternal border and the base of the heart. I'm going to now auscultate the valves with my diaphragm. So first the aortic, pulmonic, Erb's point, tricuspid, and the mitral. And I'm going to repeat that with the valve. I'm going to have you turn on your left side so I can assess for any extra heart sounds or murmurs. And I'm going to auscultate at the 5th intercostal space of the midclavicular line. Okay, you can lay on your back. S1 and S2 are regular. No extra heart sounds or murmurs noted. I'm going to now assess the abdomen. No pulsations, no masses noted. I'm going to auscultate the abdomen. Bowel sounds are normal active. I'm going to assess for vascular sounds at the aortic, renal, and iliac regions. No bruits are noted. I'm going to percuss the abdomen. Okay, the abdomen is tympanic. I'm going to now lightly palpate the abdomen. Let me know if you feel any tenderness. Any tenderness?
No.
I'm going to deeply palpate the abdomen. Any tenderness?
No.
I'm going to palpate for the liver. Just take a deep breath. Good. I don't palpate the liver. Palpate for the spleen. Deep breath. And I'm going to palpate for the kidneys. Okay. None are palpable. We're going to now assess the lower extremities. The skin is pink. The hair distribution is even. I'm going to assess the joints at the hip, the knee, and the ankles. and the skin is warm. I'm assessing for capillary refill. It is under 2 seconds. I'm gonna assess Pete's sensation in his lower extremities. I'm gonna ask you, do you feel sharp or dull?
Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay, good. I'm gonna now assess the reflexes in the lower extremities. Alright. Okay, I'm gonna have you stand up. We're gonna assess the range of motion. I'm gonna have you, I'm gonna first assess your gait. I'm gonna have you walk regularly, and then on the way back, I'm gonna have you walk heel to toe. Good, I'm gonna have you hop on one leg. Good. I'm gonna have you stand with your eyes closed. This is the Romberg test, so no loss of balance or swaying. I'm going to have you take your heel and run it down the opposite leg. Good, so he does that smoothly. Good. And now I'm gonna have you lay back down and assess the range of motion. I'm gonna have you lift one leg up and put it out to the outward and then inward, and then bend your knee down like this. Good, and then put it outward and inward. Good, okay, you can have a seat. I'm gonna assess your neurologic system. I'm gonna have you identify 2 items. I'm gonna let me know what you feel.
A coin.
Okay, and I'm gonna have you identify one more. Let me know what you feel.
Key.
Okay. Good. Okay, I'm gonna ask you to recall the 3 words that I asked you to remember at the beginning of the exam.
Door, car, phone.
Tap your hands on your knees quickly, alternating the side. Okay, good. I'm gonna have you stand up and we're gonna assess the range of motion of the spine. I'm gonna have you bend forward, backward, side to side, and then twist at the waist side to side. Good. I'm gonna assess for scoliosis. Have you touch your toes. Okay, good. There's normal spinal curvature. And then I'm gonna test cranial nerve 11. So I'm gonna have you shrug your shoulders against my resistance. And then I'm going to have you push my hand with your face. Okay, cranial nerve 11 is intact. That concludes the exam for today. Thank you, Pete.